Hello and welcome to another video from GB Pharmacist. I'm George, I'm the pharmacist here, and I am a vaccination pharmacist that works in London. And over the years, I've seen firsthand the great impacts that vaccines have had, especially in the last 4 years, on the public health, on protecting my colleagues, on protecting patients, and reducing the overall burden on healthcare. But lately, and over the last few years, vaccination rates across the board for all vaccines have been declining. This is for many reasons, and we'll use this video to go through some of those, and also how we as healthcare professionals and friends and family can increase those vaccination uptakes to prevent these previously eradicated viruses, in some examples, from causing serious outbreaks, pandemics, epidemics. I'm sure you've heard of the current one that's happening in the UK is measles. So yeah, this video is trying to break down those barriers and to empower people to have their vaccines. So today we'll explore the behavioural science behind vaccination uptake and why some people hesitate, and how we can address this. Mainly aimed at healthcare professionals in this video and how we can increase our patients and public to do that. And we'll look at it from a psychological basis, and also provide some practical nudges that I have firsthand seen that work quite well and offer powerful insights into how we can influence and increase those vaccination uptakes in our communities. So without further ado, let's get started. So let's first understand why vaccine uptake is such a challenge. And let me introduce to you a law or a concept known as Brandonoli's law. And this is basically the law that I think anecdotally is known as the bullshit theory. But basically, it's a concept that states that it takes significantly more effort for information to be debunked, misinformation to be debunked, than it does to spread it. This is particularly relevant for vaccines. There's a lot of false and misinformation that spreads rapidly and fast on social media through communities, and making it increasingly hard for the more accurate and relevant information to regain, maintain trust, and be at the forefront of your mind. A really simple example, say, if someone said the moon is made of cheese, that statement's really easy to say, but it takes a lot of scientific knowledge and lots of big words, etc., to debunk that statement that the moon is made of cheese. Reference to Wallace and Gromit there for everyone watching. So aside from this misinformation narrative that definitely has a huge impact on vaccinations and other things in life, but for this talk, obviously, we're focusing on vaccinations. There's also barriers to vaccinations, and these can be broken down into 3 categories. So you've got the capability to get a vaccine, you've got the opportunity to get a vaccine, and then you've got the motivation to get a vaccine. So we're going to go through these 3 categories in a little bit more depth right now. So let's start off with capability barriers. So these are things like the lack of knowledge about the vaccine benefits, confusion caused by the negative narratives and the stories that you see, low awareness of vaccination uptake rates, the schedules themselves, particularly amongst busy parents. Obviously, in the first few years of life, it's a busy time regardless of vaccinations, and then there's obviously vaccinations are mainly in childhood, so it's a big thing, especially for parents who are busy and maybe not aware of the vaccines that are available if they're not informed by their healthcare professionals. And then finally, another one on capability is language barriers. Obviously, working in London and in other areas, there's multicultural, so language barriers and complicated words and communication methods and etc. and etc. So some of these can have just be a simple thing that they just don't understand what's being said to them, or they can't read it, they can't access that information that is being presented to them. The next barrier to discuss was opportunity. So these are practical barriers like practical issues, taking time off work, traveling long distances, amount of slots available at the local GP or local clinic, limited convenient access to vaccination centres. As we mentioned, they might be far away. They might have no good times, especially for a working parent, take time off work, etc., etc. Social norms, religious beliefs, concerns around gelatin being in some vaccines, and obviously in some communities they might try to avoid gelatin, which is obviously from that porcine pork area. And then also you've got negative experiences with healthcare systems. Again, this can be a cultural thing, can be a family thing, that they've had a thing in their family where someone accessed healthcare systems and necessarily wasn't the best experience, or they felt they were being lied to, manipulated, etc. And obviously they do carry a lot of weight, and they carry and pass it on. Again, coming back to that Brandonoli's law, where those negative stories, narratives, experiences travel further, faster, and have more of an impact than the numerous positive experiences. So there, opportunity barriers. So it's the lack of opportunity to be able to get that vaccine, whether that be travel, time, social norms. So next up, and the last barrier to run through, is that motivational barrier. And this is basically the desire to go and get your vaccine, which can be obviously driven and affected by a lot of things. So that could be that you don't believe the virus that you're treating, the disease that you're trying to prevent with the vaccine, is bad enough to warrant getting a vaccine, or that the vaccine itself isn't as effective as being portrayed, or yeah, you're young, you're healthy, my child will be okay, they don't need that vaccine. So there's that, obviously, the motivation to go get it. Is it big enough that this will be an impactful disease? And there's also misunderstanding in that, because some of these diseases are very severe and can cause lifelong damage and even fatalities in some cases. So it's understanding that. There's also some mistrust in vaccines, and obviously the advent of COVID and all those multiple vaccines that many of us would have had has impacted that. The respiratory virus that COVID is keeps mutating, therefore you need vaccine upon vaccine. Whereas some of these other viruses, diseases, are the vaccines are very, very effective, up to 95%, and they are really combating severe diseases. So I do understand that there's mistrust in the government and those things, and COVID being one thing, but then obviously the MMR and the Wakefield issue back in 1995. So other motivational examples could be safety concerns, especially with new vaccines. I know the MMR for COVID, the mRNA for COVID was quite a big thing, but a lot of more of those mRNA vaccines are coming out, and their safety has been shown now. There's also a preference to having natural immunity, like I'd want my child to get the disease itself to then have that immunity, which in some cases, if that disease isn't too bad, hence like chickenpox and things, I kind of can understand. But some of these diseases, as previously mentioned, can be fatal, can have lifelong issues, can cause hearing, neurological, physical difficulties down the line if you contract these. So yeah, so I think I understand the narrative, but for some of these disease states, that is quite a risk to take, because you don't know how severe your child or yourself will get the disease. And then finally, there's the general fear of needles. Why do I want to go to book myself into a place to get a vaccine? Why do I want to put my son or daughter through that to have a vaccine? And obviously, it's not a nice experience. It is a needle. It does hurt a little bit, but trust me, it's better than getting the disease itself. So now we've gone through some of the reasons why people are hesitant to have their vaccines. How do we combat and approach those reasons, those barriers, to increase uptake? So one model developed by some behavioural scientists is the 5C model. I think it was done in Germany. And basically 5Cs to help combat all of those barriers and those concerns as to why people avoid vaccinations. So the first C being confidence. trust in the vaccine, etc. The next one being complacency, so recognizing the severity of the disease that we're treating. Third one being calculation, so weighing the risks and benefits in a way of portraying those risks and benefits in a way that people understand. Constraints, so then time constraints, etc. Location constraints, so it's that accessibility, that ease to go get vaccinated. And then finally, the final C, collective responsibility, protecting your colleagues, protecting your family, protecting others around you, and driving that narrative. So this model highlights the trust, awareness, and access being key to increasing vaccination uptake decisions. As you're probably gathering, vaccinations and decisions to access healthcare in any setting is driven by many, many factors. And a lot of those factors come from biases that are imposed on us or subconscious or conscious. So let's explore some of those behavioral insights a little bit more. So these psychological biases can be in the form of negative bias, where negative stories and side effects are more memorable. They travel further, as we mentioned before, they're more impactful. So therefore, you're more biased towards those negative stories and examples. There's also an optimism bias that it won't happen to me. It's not me. I'm not the one. And they underestimate the disease risks. So therefore, that motivation to go get the vaccine is not there. And then you've also got your confirmation bias. So that's where people doubt the that people with doubts don't actively seek information that is not in line with their thing. So saying it in a different way, so people with doubts seek the information that confirms their belief in their story, and therefore they disregard the things that counteract their belief, and so they only look for people that confirm it. So now we've gone through some of the barriers, some of the psychological biases that people have. Now let's again look at some ways that we can nudge people to get their vaccines and promote the vaccine uptake in this setting, but also in healthcare. So it's the marketing, for want of a better word, of these vaccines to people that need them most. And there was a study conducted I think it was in Germany again, by Milkman and his colleagues, that basically reviewed how we can increase flu vaccine uptake. And they basically found that framing vaccines that are reserved for you, that are waiting for you, increase the uptake by 5%. So that's that ownership. This is for you. And also, the science behind this is that endowment effect, where people value something if they perceive that it's theirs. I.e., if I gave you a pen as a present, you're less likely to sell or give that pen away than if I told you to buy exactly the same pen. That's how the endowment effect works. There was also another study done by Milkman and his colleagues in relation to messaging and the convenience of getting a COVID vaccine affected the booster uptake rates. So they found that default appointments that dramatically increase uptake, that if you had a vaccine before, they can match the timing to what you previously had, so they know that kind of works with your lifestyle. I'm also encouraging patients to plan specific vaccination dates and times improves effectiveness. So given the patient in this sense, or the person booking their vaccines, free rein as to when and how, and obviously fit to their lifestyle. Again, increasing that capability and that accessibility factor, and also like localization of messages, so referencing infection rates in your local area, and really bringing it kind of back to home again, bringing that kind of this is relevant to you, this is for you mindset. And the top performing messages seem to appear directly to the patient's regular pharmacy, someone who they know, trust, and like, leveraging that trust and leveraging that familiarity with their healthcare systems, i.e. it's not coming from some random NHS number. So we've been through lots of information. We've gone through reasons why, some laws, some concepts, some biases, and also some studies that showed to increase uptake. So how do we address this vaccination hesitancy? And it all basically starts with tailored communication, addressing individual people from trusted and appreciated people, and applying insights from behavioural cases, behavioural studies into our messaging. So making the information clear, readable, understandable to all of the members that are going to be reading it, and making it relatable and making it from a trustworthy source, using defaults and reminders to simplify the decision making, and also building trust through localized and professional research and communication messaging. So vaccines are a collective effort. It's a population public health drive. By understanding the behavioural sciences and barriers and leveraging off these, we can improve vaccination uptakes. We can protect ourselves, protect our families, protect our colleagues, and reduce the risk of there being any further outbreaks, endemics, or pandemics from these vaccines, from these viruses, obviously, that the vaccines prevent. So that's all for me in this video. I hope you found it helpful and insightful, looking into the behavioural and psychological factors behind hesitancies in healthcare and vaccinations in this sense. To get the video reaching further and to create more of an impact, like, comment, share, etc. And maybe subscribe will help us to continue making these videos and continue to help you as pharmacy and healthcare professionals, but also the community that we serve. Together we can build a healthier future. That's the goal. That's all from me. See you next time. Have a great day.